I'm David McGill. I'm a physical therapist with Mountain Land Physical Therapy. I'm up in our Park City clinic. I wanted to talk today about back pain, maybe some long-lasting back pain or chronic back pain that's been giving you trouble for a while. A few simple exercises that can really help to reduce that back pain. However the injury started, this is some things that you can work on to really help improve that pain. So a lot of times we sit too much, whether it be for work or driving or any other types of daily tasks that we do. So let me walk you through some of those things. One of the biggest things we try and impact is the hip flexor. Hip flexor tends to attach to the spine and can really pull you into extension, causing pain. So we're going to try and get after that hip flexor and a few other things. Let me show you how we do that. So one of the easiest exercises is while you're lying on your bed or hanging off the couch, we're going to set this leg down. Now, if I do that, it's going to arch my back, and that's not going to help me. So I need to really make sure that I'm trying to hold my back flat first, and holding this leg up will accomplish that. So I'm going to hold this leg up. I'm going to set this leg down, and you can feel it kind of floating and feel that tension in the front of that hip flexor. This is a simple way to try and get a good stretch through that hip flexor. Now, if you get any pinch on this side, just let that hip kind of hang out a little bit. That can make a big difference. Now, before I bring this back up, I'm not going to set this down. I want this on the table first, so again, it doesn't arch my back, and then set that down. You're going to hold that stretch for about 30 seconds. And you can do both sides. The next thing I'm going to do is get into a glute or piriformis stretch. If I have some nerve pain down my leg, a lot of times that nerve runs underneath this muscle and can be tight, adding to the problem. So I'm going to kind of grab my ankle, grab my knee, and I'm pulling across my body, feeling that right down here in the backside of my hip and leg. Now make sure I'm not getting a pinch in the groin. That's not what we're after. We're after this. If I am getting a little pinchy, you might have to play with that a little bit to find that appropriate position to feel it here. And then I'm feeling that good stretch right in the glute. Again, about a 30-second hold. A lot of times to open up that space in the back, we're going to pull those knees up to the chest. You can either do that double leg or single leg, just trying to get some room in the back at the joints. And then the last piece is we want to get a little bit of that core working. So flatten that back to the table. I'm kind of doing a pelvic tilt where I'm squeezing and pushing that back into the table. If I really want to progress it, I can even lift up a little bit. And now I'm really working that core. Support the head so I don't strain the neck, but I'm really getting that nice pelvic tilt, which again is opening that space and getting more support for the core. These are some simple exercises that can make a big difference, even if they don't seem that way. So give them a try. If that's not helping to address some of the pain that you're dealing with, give one of our clinics a call and we'd be happy to help you out.